It's not surprising that people are feeling frustrated. You know, we are now well over a year since we reopened face-to-face, and working in the conditions that we are or have been working in for the last 12 months, and certainly working in the summer months in high levels of PPE, where the temperature outside or in the surgery is very high, is incredibly stressful and very demanding on people. Patients, you know, we're very sympathetic to knowing that there was a problem gaining access, but now we are 12 months into that, and patients are becoming more aggressive, slightly more abusive to members of staff. You know, if they can't get what they want, which they perceive to be urgent for them, but perhaps not urgent when it's triaged. All of that, you know, it's a really melting pot of difficulty that we face in the industry at the moment. Perhaps the pre-planning before the pandemic was badly done, for sure. You know, and I'm sure when we do a review of what has happened with healthcare and the pandemic, that will come out. That, you know, basically the reason dental practices were closed from the end of March to the 8th of June was the massive shortage of PPE. And the pre-planning for that, it was left to my colleagues really to develop urgent dental care centres, which were insufficient in number to deal with the volume of patients that needed treatment. Many of my colleagues gave their PPE away to other areas of the health service, to people in hospital who didn't have sufficient PPE to protect themselves. So, you know, if blame is to be laid at anyone's door, it's certainly the planning that was there for a pandemic scenario. The blame at the moment, the communication perhaps from NHS England and Department of Health to the dental profession and to patients has been incredibly poor throughout. And often it's relied on the British Dental Association or other organizations like Health Watch to actually get messages out to patients about the problem. Very little communication directly from MPs or ministers about the issues that are particular to dentistry. When they've been asked in Parliament in the past, there was a situation where the health minister stood up in Parliament and said that all dentists had sufficient PPE early in the pandemic, which was clearly inaccurate. And that has caused huge frustration amongst the profession, because patients are then saying, well, why aren't you open? You know, I've been told on TV by the minister that dental practices have adequate PPE when that wasn't the case.